Okay, here's my 5 favorite exercises to begin addressing neck pain. And when I say favorite, I mean the best exercise to set your foundation for success. And then from there, we build off it. So we're gonna start with a couple ways to release the muscles, then we're gonna address the joint, we're gonna next build some strength and stability, and then ultimately act on your nervous system. To stretch this levator scapula, you bring your arm behind your back and just let it kind of sag there on that side. Then you tilt your head away and look down towards that side. You'll already feel an intense stretch, which you can just hold here for a bit. But then to intensify it, you bring your hand up and pull down for a hold. This is the levator scapula, and you can see when it's tight, it pulls the shoulder blade upward like that. So we bring the hand behind the head, because watch this shoulder blade here. As you come up, it starts stretching the muscle in the opposite direction. So just by relaxing here, we've already put a stretch on the muscle. And then to intensify it further, we're going to tilt away, and then we can even really put the icing on the cake by rotating the opposite direction for a hold. So during the movement, you want to really be up tall. You don't want to be hunched forward like this. You got to be up tall, go through the movement, and you will feel quite a bit of intensity all through here, really through there. If it feels like a very tight band, that's normal, and it should stay right through here. So just take your time with this stretch, give it a hold, and watch it just loosen up. So if you're stretching this side, you bring your arm behind your back on that side, shoulder blade down, looking straight ahead. It's a pure tilt, ear to shoulder, in the opposite direction. Then you come on top and give a pull like this for a hold. Now, there's anterior, middle, and posterior scalenes. To make sure you get all of them, in this position you can kind of look up a little. That'll get more of the anterior and middle scalenes. And then you can work on going down a little. That will get more of the posterior scalenes. So either way, the first thing is chest up, being tall, head back, arm behind the back, tilting opposite direction without rotating or twisting, just purely tilting and pulling. And then from there, after you give this a hold, you can kind of tilt forward for a hold, and then you can tilt back a little past neutral for a hold. And it'll help you get the different parts of the muscle. See, the scalenes attach from these first ribs here to the side of the vertebrae. So when you tilt them, you get that stretch, and then when you look up, you could see how the anterior one and the middle would get more stretch. And then when you do the tilt the opposite way, you could see how the posterior would get more stretch. So that's why we do it like this. And for these stretches, you're just going to feel some pulling kind of through here. Okay, there's not going to be much else to it. And then you just give it a hold like that. Okay, we've primed your muscles, and now we need to start addressing the function of the joint. So you're sitting very upright. You bring your head all the way back as far as you can, and then you push on your chin, which is your overpressure. And you want to make sure that your head is moving on your neck and that this isn't forcing you to move through your whole body. So everything from here down is fixed, and you tuck back as far as you can and push. Now you pick a spot on the wall in front of you where your gaze is fixed, so your head goes straight back. I want you to imagine your vertebrae. When you look down, what do? They tilt forward. When you look up, your vertebrae go back. But when we do a chin tuck, the bones in your neck just slide on top of each other. So you're trying to make like a double chin, just like that. If you have discomfort and compression here, you may be extending too much. So what you can do, for starters, is try to fix your form. But if that still doesn't fix it, you can tilt down about 10 degrees and then kind of go up and back like this, just like this. And then over time, you should be able to do it in a straight on position again. And the correct form for this is that not only is your head coming back, but you have to imagine a string on the top of your head. And so as you come back, there's a lift. As you come back, there's a lift. And you'll feel like your upper neck is going into a decompressed position, like it's lengthening. So you're coming straight back from like more of a compressed position to a lengthened position, just like this. In between reps, just come to neutral. Don't do this and this, this and this. So you're sitting upright, come back and push. If for some reason you have jaw pain with this, which even people with TMJ disorder and jaw pain, 99% of them won't have any pain. But if for some reason you did, instead of pushing on the chin, you can push above the upper lip like this. And that will help you a lot. But if it doesn't matter, either way, I would push on the chin because you have a better biomechanical advantage. So again, you're extended up through the spine. And then when you do the actual chin tuck motion, all the movement happens here. The head comes back, the vertebrae get stacked over each other. And this exercise is to fix alignment of the actual vertebrae to free up the nerves and joint space. It's not actually for the muscles. We're not trying to strengthen with this. We're trying to get you into a better position. And with this exercise, if you have any discomfort that starts radiating into the top of the shoulder, down the arm, even into the shoulder blades, and no matter what you do, it just won't go away or it's worsening, then I would pause with this exercise and we need to give you a different variation. So give that a try. Now we want to build some strength in the muscles that connect shoulder to jaw. So you're going to bring your elbow up to shoulder height and you're going to rotate upwards like this and then come back down. Upwards like this and come back down. So if you look at me from the side, my elbow stays at the side of my shoulder and I'm going to rotate this way and then back down like that, okay? Nice and easy. After you do a set of 10 of that, take a break, and the next set's going to be a little more challenging. You're going to do your rotation and press up. Rotation and press up. And as this is happening, what you're trying to do is keep yourself in upright posture, because as it gets strenuous to lift your arm, you're going to want to sink forward. But that's part of the strengthening process that you're going through. So give that one a try. Now, another thing I like to always discuss is neuroplasticity, which is your body's ability to learn. That's what neuroplasticity is. It's making new connections. And a lot of the time when we start having pain or symptoms on, for example, one side of the body, our brain has learned to check into that. It can produce more pain over time because that connection is stronger. You have a superhighway. So sometimes what I like to tell people is, let's see what happens if we think about the opposite side of the body, which does not hurt, and we start focusing on it. Or if you feel that both sides of your body hurt equally, pick a totally different body part, like your knee. And I want you to close your eyes for a minute and think about that side or that area that does not hurt, and think about it and think about it. Don't think about anything else, keep focusing on it. And what you'll start to notice is you start picking up new signals from that area. Oh, wow, that feels a little tingly, or there is pressure in that area, or a light breeze, or anything at all that you weren't thinking about before. And the longer that you do this, the more you start picking up other sensations. And the point I'm trying to send home to you is that a large majority of pain, or at least a portion of it, can just come from your nervous system thinking about it. You've been in pain for 3 months, 6 months, or longer. This can be half of the battle. And so now that you kind of understand that concept, I want you to do something where you're not going to focus on the pain. So I want you to pick an object, pick something bright and shiny. Sometimes I use this red mushroom right here in my mind, and I want you to focus on it for 1 minute. Close your eyes, think about the details, what it looks like, what it might feel like if you touched it. And the whole time you're thinking about this, you're not paying any attention to whatever your main pain is, okay? And if your pain starts coming in, trying to say hello to you, what I want you to do is acknowledge it without emotion. So you just kind of put it to the side and say, all right, I feel what's going on here. I'll deal with that later, but I'm doing something else right now in a non-emotional way. This is called neuroplastic strengthening, because part of our pain that goes on is our decision to let it in or to not let it in. To give into it and say, I'm going to think about that, versus, no, I'm not going to give that life. And so if you can understand, number one, that we pull in sensations based on what we think about, and number two, you do have control as to allowing it to manifest or not, you can start rewriting your neuroplasticity. So it's something I just wanted to tune you into. This is the 5th exercise I wanted to show you. And if you really practice this for a minute, maybe once or twice a day, you can see how much power you actually have over your pain. And there you have it. We've taken 2 exercises to prime the muscles for success. We've acted on the joints themselves. We've built stability and strength, and we've addressed your nervous system. So get started with those. And if you have any questions at all or need help, don't hesitate to reach out to me.